Good morning and welcome to another Ministry of Health COVID-19 update. Your presenters this morning are Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, Mr. Davlin Thomas, CEO of the North Central Regional Health Authority, and Dr. Mariana Allen, Pediatric Consultant and Secretary of the Pediatric Society of Trinidad and Tobago. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's COVID-19 update. We will begin with Dr. Hines, who will provide the latest clinical, vaccination, and epidemiological updates. Morning, Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Allen and CEO Thomas. Good morning to members of the media, members of the viewing and listening public. This morning, we will have the brief epidemiological and clinical updates. If I may have the next slide, we'll go straight into it. So as at yesterday, we note that we would have tested in excess of 293,000 individuals, and of those, 42,233 tests would have returned as positive. Out of those 42,233 individuals, we would note that 35,071 have already recovered, and we have currently 5,966 total active positive cases. Those active positive cases divided as follows: 5,282 in home self-isolation, 313 individuals hospitalized, 93 individuals in step-down facilities, and 278 new positive cases reported at the last run within the last 24 hours, with samples taken during the period August 13th to 16th, 2021. There have been 1,196 COVID fatalities, and we extend our condolences to the members of those bereaved families. There are also 134 individuals currently in state or state-supervised quarantine facilities. With respect to the vaccination status, as at 4 p.m. yesterday, the total number of persons vaccinated with one dose or the first dose of either the AstraZeneca or Sinopharm would be 457,991, and of those, 329,737 persons would also have received their second dose of a vaccine, noting that after your second dose, you're considered to be fully immunized at a 2-week interval beyond that. Next slide, please. Going directly into our epi curve, we see the gray bars to the left, which we will soon sort of remove to make space for the remainder of the year. Those gray bars representing the end of the 2020 epidemic year, so from July to December. Then the colored bars representing each month from January through to August, August being the indigo colors on the right-hand side. What we're seeing, looking at both the height of the bars and looking at the shape of that dotted line running through the graph, we're seeing that we've had what we consider to be a plateau or maybe even a slight rise in the numbers of cases in the July to August period. Not a steep increase, but we are monitoring as we see that we have increasing numbers of cases or a slowing in the decrease while we adjust our movement. We adjust our levels of movement. We're seeing variations between plateauing and small increases from one week to the next. This is better seen in the next slide when we aggregate this data to the weekly time scale. What we're describing becomes a little easier to follow. Those fuchsia bars being July, the indigo ones being August. We see that they're all approximately the same height. We did see a little stepwise increase, small percentages, 1%, 5%, 8% increase. The August figures are comparable, that week 32 having some additional numbers added to it by the investigation of a cluster that would have added to the total number of positives. So we're seeing where basically the same numbers of cases on average are coming in from week to week over the last about 6 weeks. And we're keeping an eye on this because we know there's a delicate balance between movement and transmission within the population. The other feature of note on this graph is the salmon portion at the back, which represents positivity or number of cases, number of positives that we get out of every 100 samples that we test for COVID-19. And we do see that it has hovered around 30% thereabout over the last few weeks. It has not trended downward significantly. So again, we're monitoring this plateau with hints of a slight rise in the last 6-week period or so. Next slide. We look at the same data now aggregated on a monthly basis, and we do see that overall from May to June to July, there have been month-on-month decreases. We are hoping that by the end of August, we will also register a decrease. We will see what happens by the end of the month, but it's also quite possible that August will end at figures that are quite similar to those for July, given the plateau, the sort of even numbers that we're seeing coming in over the last several weeks. And we monitor both that and the overall positivity, which basically mirrors the positivity that we would have seen in the weekly graph. Next slide. Looking at the demographics, that's the age and sex breakdown of the numbers of positives, we see that the demographics haven't changed much. The shape of this pyramid hasn't changed much. We see small numbers at the bottom representing relative protection of that pediatric age group because they've really been sequestered. We see the largest numbers in that 25 to 49 age group, and that corresponds to about 52% of the cases. And we see that the male-female balance is just about 50-50. It's actually swinging a little bit in favor, quote-unquote, of the females, meaning it's now 50.2% women and 49.8% men as at this point in time. Next slide, please. Finally, among the fatalities, there are a few things to note. The first is that to be overrepresented or most represented among the fatalities. The second is that the male-female balance has swung quite notably from being about 3-1, 75% men, down to 57% men, so approaching more similar proportions to the total positives. And also, we emphasize that among these individuals who have passed on, there is a high prevalence of comorbidities, that is, other existing diseases, usually chronic diseases like diabetes, hypertension, renal failure, sometimes underlying cancer treatments, things along those lines, which put people at increased risk of an adverse outcome, and which is a point that we re-emphasize when we encourage especially individuals with comorbidities to ensure that they get vaccinated to reduce their risk of severe illness and death. So with that, I tie up the relatively brief epidemiologic and clinical update and turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. Now, for students and parents, today marks the start of a very important step towards the reopening of schools and in-house classes. This morning, we are pleased to have Dr. Allen, who will speak to the benefits of vaccinations generally and more specifically, vaccinating children. Dr. Allen, morning.
Thank you very much, Mr. Alexander. Good morning to Dr. Hines and Mr. Davlin Thomas, to members of the media and the viewing and listening public. Good morning. I'm very pleased to be here this morning to talk from a pediatrician perspective on vaccination in children. Now, Trinidad and can I have my first slide, please? Thank you. Next slide. Now, Trinidad and Tobago has had a history of having a very well-organized and successful immunization program. And we have been lauded in the past by the WHO for our very high immunization rates of more than 90%. And this high immunization rate in the past has really protected us from some of the recent outbreaks of vaccine-preventable diseases like measles that occurred in the United States, Latin America, and even parts of Europe. Next slide, please. So on the background of that, we know that vaccines work and we have trusted vaccines in the past. So today we're here to talk about specifically the Pfizer vaccine and children. Currently, it's the only vaccine that's approved worldwide for the use in children from 12 years old. And I've listed here some countries that are also using the Pfizer vaccine for children 12 years old and older. The WHO, who's the regulatory body who we follow here in Trinidad and Tobago, has authorized the use of the Pfizer vaccine for children. Next slide, please. So why should we vaccinate our children against COVID-19 infection? I'm sure most of you have heard that most children will have mild disease and will recover. While this is true, there are some children who will not have mild disease, in fact will have quite severe illness, end up in hospital, sometimes in ICU, and unfortunately, some children may die. We know that the COVID-19 infection can cause a multitude of system effects on the kidney, on the heart, on the brain, and other organs of the body. And I know Dr. Paul has been here on numerous occasions talking about the phenomena of MIS-C, which is widespread inflammation caused by the body's excessive immune response to the COVID-19 virus. And some figures coming out of the United Kingdom recently suggest that 44% of children who have this MIS-C phenomena end up in the ICU. And we know so far we have had 52 cases of MIS-C in Trinidad, and these children requiring the intervention of the pediatric cardiologist, pediatric neurologist, and pediatric nephrologist. There's also the phenomena of long COVID, and we see that about 8 weeks after the initial COVID infection, where children continue to have malaise, body pains, brain fog, and very debilitating lung injury caused by COVID. Now, Delta variant is the variant of most concern, and currently the Delta variant is said to be the most prevalent one in the United States. And we have seen from reports coming out of the United States that it is indeed causing more severe disease in children. Next slide, please. So let's look at the numbers, and this is coming out of the Mayo Clinic in the United States when they looked at all the research related to the Pfizer vaccine and its use in children. They found it to be 100% effective in preventing infection in the age group 12 to 15, 95% effective in preventing symptomatic illness in those 16 and over, and 96% effective in preventing the severe disease that we've been seeing caused by the Delta variant. Next slide, please. So, what are some of the benefits of vaccinating? So certainly we would want to prevent COVID-19 infection in as many children as we can. We certainly would want to prevent any serious illness and death, especially if, unfortunately, the Delta variant is introduced into Trinidad and Tobago. Many children live with vulnerable family members, grandparents with comorbidities, or even a sibling or a parent with a comorbidity. So we would like to protect the vulnerable family members that they live with. And this is something that I really want to emphasize, my next point, that in addition to the medical implications of COVID, we have all these other effects on children, and refer to it as the COVID-19 toll on children. Children have been missing out. There have been no graduation exercises, they can't play their team sports, they can't socialize with their friends. We have interrupted education. We know that some children just do not cope well with online learning, and some children have limited access to resources that would make online learning successful. There are also the effects on mental and emotional health. Children have been, according to Dr. Hines, sequestered for quite a long time, and we have seen increases in anxiety, we've seen increases in depression, and the effects on physical health. Obesity because of the lack of exercise. Many children now have found themselves behind a computer screen all day, going from class to video games, back to class again. So we have an increase in obesity. Because of the general fear of COVID, we also have the phenomena of children not being presented for their well children or well baby visits at their health centers or at the doctor's office. So we are at serious risk of that 90% vaccination rate that I talked about earlier falling. And unfortunately, there is also the phenomena of increased violence in the home that we have seen during this COVID-19 period. Next slide, please. So, some of the side effects of the Pfizer vaccine are common vaccine side effects. We all recall that when we've taken our children to have their childhood immunization, the healthcare provider would tell you a little bit, your child may have a little bit of pain, may have a little bit of redness at the site, a mild fever or chills, and would be a little bit out of sorts with headache, feeling a little fatigued or nauseous. And you always advise to use Panadol or ibuprofen to counter the effects of these common vaccine effects. And it is the same with the Pfizer vaccine. But there is one, next slide, thank you. There is one other effect that I would like to touch on this morning. Does the Pfizer vaccine cause myocarditis? And what is myocarditis? It's actually an inflammation of the heart muscle. They have found that it is extremely rare post the COVID-19 Pfizer vaccination. And it usually occurs in the older teenagers, 16 and above, and young adult males up to the age of 30. And from all the studies done in Israel, in the United States, and the United Kingdom, all of these patients who experience this very rare phenomena have had mild disease and recovered without any special treatment, and there've certainly been no deaths related to the myocarditis associated with with the Pfizer vaccination. But some of the signs that we would advise that you look out for are palpitations or feeling that your heart is racing in your chest, shortness of breath or any chest pain. And the phenomenon, when it does occur in these rare circumstances, usually occurs after the second dose. But in comparison, COVID-19 infection also causes myocarditis. And I've put some figures here, and these are recent figures coming out of the United Kingdom, that they've had 76 per million in 12 to 17-year-old age group, and 450 million, and that's supposed to be the 18 to 30-year-olds. So we see that the chance of getting myocarditis from the COVID-19 virus infection is much, much more likely than the chance of getting myocarditis from the Pfizer vaccination. Next slide, please. So, you're thinking about vaccinating your child. I know it's for some of you, it's a consideration and you have concerns. So the first thing I would suggest is have a conversation with your family doctor or your pediatrician. But there's a group of children that we really want you to consider especially. And those children are the ones with neurodisability, any chronic illness like sickle cell disease or diabetes, children with obesity, trisomy 21 or Down syndrome, the immunosuppressed, and children who have profound multiple disabilities. Post-vaccination care, encourage oral fluids and rest. We suggest you have paracetamol or ibuprofen at home if required for the mild fever or body aches. But if you have any concerns after your child has been vaccinated, certainly reach out to your healthcare provider or any healthcare provider who may be able to give you advice. Next slide, please. So, in summary, the Pfizer vaccine is safe and effective, and vaccination of the nation's children 12 to 18 years old is supported by the pediatricians of Trinidad and Tobago. It's widely available, thankfully, starting today. And there will be pediatricians or other healthcare providers at each vaccination site in case you have any concerns that you would like to be addressed at that time. Otherwise, there's information on the Ministry of Health website and the Pediatric Society of Trinidad and Tobago social media pages, which may be able to guide you. Thank you.
And
Next slide.
thank you, Dr. Allen. As we close off this morning's presentation with Mr. Davlin Thomas, CEO of the NCRHA, Mr. Thomas will update us on the vaccination rollout in his region and the recent staff training done in preparation for the Delta variant. Mr. Thomas, good morning.
Thank you, Mr. Al Alexander, Ministry of Health Corporate Communications, Dr. Hines, Epidemiologist, Ministry of Health, Dr. Allen of the Pediatric Society of Trinidad and Tobago, members of the media, staff at the TTT, viewing and listening public, good morning. Just some brief notes on the staff on the NCRHA health centers providing walk-in vaccinations, and those are walk-in vaccinations at these health centers. The Arima Health Facility, and you can have your vaccinations done by just walking in at, and I repeat, the Arima Health Facility, the Blanchisseuse Health Center, the La Hoquita Health Center, the Maloney Health Center, San Rafael Health Center, Talparo Health Center, the Chaguanas District Health Facility, Canupia Health Center, St. Helena Health Center, Aruca Health Center, Macoya Health Center, St. Joseph Enhanced Health Center, and the Tacarigua Health Center. We continue to provide vaccinations at the mass vaccination site at the UTT Monroe Road campus facility, at the Wallerfield drive-through. We have done outreaches and continue to provide outreaches at Lopino, Bonnet Gardens, Larry Gomes Stadium, and a number of other business places over the last weeks. We also have begun rollout this morning, and we're happy to report with tremendous response that juveniles from 12 years to 18 years old have been receiving vaccinations at the Wallerfield Raceway, the Larry Gomes Stadium, and at the Costat El Dorado campus at College Road, Tunapuna. We continue to engage appointment in addition to the walk-ins with those NCD patients who we are tracking, and those are non-communicable diseases. We also provide appointments for those second dosers who can also do walk-ins because the appointments are on their cards. The total number of vaccination doses that we've distributed to date are 154,350 doses. We continue with our premium elderly express experience, and to date at the homes for the elderly, we would have vaccinated 1,085 persons at approximately 57 homes, which represents basically about 98% of those homes within our catchment area. We certainly again we applaud the staff of the NCRHA who continue to engage vaccinations with all of their capacity, strength, and sagacity. Our inherent oxygen capacity at our COVID-19 facilities are 200%, and we're basically standing by if there's a need. We've as well launched an app for our patients. It's Preview Checkup NCRHA. Those are for our quarantine patients within the NCRG, and that continues to go well. So we are monitoring them via the app. In addition to the training, we've done a significant amount of training in readiness for COVID-19, and we continue to for COVID-19 care, and we continue to provide those categories of training include 3 levels of emergency care training, to the extent where we've trained security officers, cleaners, patient escorts, patient care assistants, at a total of 250 persons. These also include registered nurses, etc. We've had guidelines for the management of COVID-19 patients, sensitization, and that began 2 days ago. And these are refresher courses. So we've had CPR refresher courses, and we've done 90 persons so far. Again, basic life support, 697 members of our staff, psychosocial support and mental health awareness for our staff. 713 members of staff have had access to this training. Conversations on mental health for all our staff. It's available to all our staff via our webinars, and we've engaged at least 411 of our staff in this type of engagement. The COVID-19 vaccine sensitization, 766 members of our staff have been engaged. The ICU induction and care and ventilated patient overview, we're retraining again. It began yesterday. Emergency medical technician, we've done that for our patient escorts. That began yesterday simultaneously. The critical care boot camp refresher, again, that began on the 18th of, today, and certainly as a refresher, we would have trained over 4,000 of our staff in boot camp, in a critical care boot camp. Or nasopharyngeal swab training, 181 persons. Respiratory spirometry training, 85 persons. ECG programs for registered nurses and refresher courses, 115 of them. Basic emergency care training, boot camp for experienced nurses, 658 of our nurses have been retrained. The care for the ventilated patient, in particularly important for COVID-19 patient, another 400 doctors and registered nurses have been retrained. Intensive care training for new employees, doctors and RNs, 93 of them have been trained. 73 registered nurses and training, which is focused for the recognition of seriously ill patients. We've trained again another 73 doctors and registered nurses. The ongoing intensive care phase 1 and 2 care training for doctors and nurses, which include about 697 doctors and nurses have been trained. Infection prevention and control, which is also ongoing. We've trained 4,565 persons to date and continue to retrain. And again, this is very important. Infection prevention and control. Managing conflict during times of crisis, which again is from the psychosocial end. We've trained 110 persons within the RHA to build in our own inherent anti-fragility and capacity. The lifting, moving, and handling of critically ill patients, we've trained 200 persons. Principles of accurate documentation for nursing, retraining, and refresher courses, 200 persons. Medication safety guidelines, refresher training, 197 persons, and certainly ward management and for nursing staff, another 100 persons. Thank you, Mr. Alexander.
And thank you very much, CEO. We now go to our You Speak segment. On You Speak, we reach out to you, the public, to hear your concerns and have members of our panel answer the questions. This week, the team visited AREMA. So let's hear what you, the public, had to say.
The Ministry of Health knows you have your concerns about the COVID-19 vaccine. That's why we decided to come to you. Last week we were in Dibe, this week we're in Arima to answer your questions and address your concerns.
I want to know if when you take the vaccine, anyone on the vaccine, if you can be able to give blood to anybody.
Okay, that's an excellent question. And the answer is yes. Once you're not having any post-vaccination side effects like the fatigue or the body pain or fever or anything like that, then you are encouraged to go ahead and continue with your blood donations. Or if you're having any of those side effects, you might want to give it maybe about a week. Once your side effects settle, then you can go ahead with your blood donation as previously arranged. And we also want to encourage the population, take the time to give a plug for the population to consider voluntary blood donation, i.e. that means blood donation not for a specific individual or to replace units lost or used, but really just volunteering to top up the existing blood supply. So thanks for that question.
Why is it so important for children to get vaccinated? Secondary school children.
Thank you for that question, and that question was an excellent question. We know that traditionally the use of vaccines worldwide has been to curtail the spread and the severity of vaccine preventable diseases. And it is no different with COVID-19. And now we have the Pfizer vaccine, which we've seen from the numbers, can help mitigate the spread of infection, can prevent children who do become infected from becoming seriously unwell, and can, more importantly, help the children and the young people get back to the quality of life that they're used to and will be healthy for them. Thank you very much.
Why is the AstraZeneca the vaccine? Why is the length of time between the first and second dose longer than the time for Sinopharm?
Okay, that's another excellent question. Now, when they were doing the research, when they were actually looking at the administration of the vaccines and monitoring your immune response, what they found is that the immune response, the way the body responded and produced antibodies, etc., for the AstraZeneca vaccine, that was best boosted by the interval or the time frame that they had found, 8 weeks or even longer. They got better immune responses with intervals at that length. When they did the same study with Sinopharm, they found that the immune response was best boosted with doses spaced that 3 to 4 weeks apart. So each set of research gave a slightly different set of guidelines for the timing for the two different vaccines. So it's all research based, and it's all based on the strength of your immune response and the way that your immune system responds to the two different kinds of vaccines. So it's based on very sound and careful research.
Is the vaccine going to be mandatory for the ones who don't want to be vaccinated, like myself? Is the vaccine going to be mandatory, and why is it going to be why is it mandatory then for those who don't want to be vaccinated?
Okay, as the Minister and the Prime Minister, Minister of Health and the Prime Minister both said on more than one occasion, the policy at this point in time is for voluntary vaccination. This has not been made mandatory, and we continue just to encourage the population to take the vaccine, both for their own sake in terms of reducing their own risk, and also for the sake of protecting people around you as an individual, people around you who cannot be vaccinated. But at this point in time, the vaccine is not mandatory. That policy has not changed.
You had the questions and we provided the answers. Look out for us soon coming to a location near you. In the meantime, don't forget the 3 W's. Watch your distance, wash your hands, and wear your mask.
We thank the public for posing these very important questions. and of course our panelists for providing the responses. I invite you to address your COVID-19 questions to us and look out for the You Speak team in your area. Now we go to the question and answer segment. We ask that the representatives state your name and the name of the media house that you represent before asking the allocated 2 brief questions. Please ask both questions, one right after the other, to the relevant members of the panel. And of course, if time permits, we will facilitate a second round of questions, 1 question per media house. The next portion of the... So we start with Guardian Media, CNC3.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. So my first question, Dr. Hines, I think you might be the person to answer this based on who we have today on the panel. We were told on Monday that on Tuesday, the Ministry of Health would be meeting with some stakeholders to determine the policy position on pregnant women receiving the Pfizer COVID-19 vaccine. I just want an update on that. And my second question is to Dr. Elaine. Dr. Elaine, being a medical professional, and what we've been hearing in the public domain about parents choosing not to get their children vaccinated, would you advise that maybe something more is needed by parents when making that decision, as opposed to just looking at what they're seeing on the internet? Should a discussion be had with that doctor before taking that decision not to vaccinate their child?
Okay, 2 excellent questions. The first, I'm quite happy to be able to update you that there was in fact a meeting convened by the Minister of Health yesterday, and it included key stakeholders from all of the RHAs, from PAHO and CARFA, from private obstetricians and gynecologists, neonatal intensive care unit specialists across both the public and the private sector. And this was led by the Ministry of Health team, the Chief Medical Officer, the Director of the Directorate of Women's Health, Dr. Adish Surju Singh. And after both reviewing the scientific information as well as presentations by PAHO WHO, there was universal consensus that the ministry is indeed in a position to recommend the use of this Pfizer-BioNTech COVID-19 vaccine for pregnant women beyond the first trimester of pregnancy. Additional details on the rule out, the communication plan, the way in which this will be executed will be brought to you by the Director of the Directorate of Women's Health in a subsequent press conference. But we can say that at least that consensus has been reached, so we'll be moving towards that in the near future.
Thank you very much. We now go to 98.1. Thank you very much. We now go to 98.1.
Oh, actually, the second question is for Dr. Elaine.
Oh, sorry.
Thank you for that question, Mr. Khan, and that's an excellent question. We as parents always want to be sure that we are doing the right thing for our children. And there's a lot of vaccine hesitancy surrounding this COVID-19 vaccine. There's a lot of information on the World Wide Web, some of it quite incorrect. All the pediatricians who belong to our association, our society, are ready and willing to counsel any parent, to have a sit-down discussion with any parent. And I want to add, not only the pediatricians, but we've had discussions with the general practitioners as well. So any parent who has questions, who is concerned, who has fears, we are ready and willing to have a sit-down conversation with you, discuss with you the pros and cons of vaccination for your child, discuss with you what is relevant to your child's health in terms of past illnesses, so that we can chart a plan that will be best suited for your child in terms of COVID-19 vaccination. Thank you.
I'm wondering, Dr. Allen, if you'd want to share some contact information.
Yes, we are the Pediatric Society of Trinidad and Tobago. We are present via email at thepediatricsociety.tt@gmail.com, or we also have a very public Facebook page, the Pediatric Society of Trinidad and Tobago, and members of the public can interact with us via those media and we will get back to them. If not, you talk to your own family physician or your own family pediatrician. Thank you.
Thank you very much, Dr. Alain. We now go to 98.1 for your two questions.
And a very good morning to you, Mr. Alexander, and to Dr. Alain, Dr. Hines, and of course CEO Davlin Thomas. Stephen Cummings, 98.1 FM. My two questions quickly, one for Mr. Thomas and the other for either Dr. Hines or Dr. Alain. First of all, CEO Thomas, you gave us a very comprehensive report there in terms of the training of staff in preparation for not just the Delta variant, but emerging issues and situations. But I'm not sure if I heard anything about dealing with the language barrier, which sometimes poses an issue to persons within the medical fraternity, especially patients, in terms of the language and translators. Were those two areas part of that training program as well? And just an extension of that question as well. What is the content in terms of local as opposed to foreign professionals within the system as well? And Dr. Hines or Dr. Allen, you can probably take this one as well. And I think Dr. Allen may have answered this in part, but I would pose it again. Apart from direct prevention from being infected or having an adverse outcome from the COVID-19 virus, what other medical overall health benefits that can accrue from being fully vaccinated, for example, or, can one also be protected from other common diseases? And this question actually came from one of my callers. And I'm reading where as well scientists are exploring ways to use the messenger RNA technology being deployed in the COVID-19 vaccine as a way of detecting cancer or maybe even fighting cancer. Dr. Hines or Dr. Alain, you can take that second one. Thank you.
Mr. Thomas.
In terms of I think you hit the nail on the head. We do have, with regard to the language barrier, or at least the language bridge that we need to generate, we inherently, due to the fact that we have a number of Hispanic, particularly Cuban nurses and doctors who are already in the system, and also I'm happy to say that we welcomed over the last month or so another 12 to 15 Cuban doctors and nurses for particularly ICU care and for some of the other subspecialties. I don't have the exact number of the composition within the system here, but we'd be happy to give you a sense of what that is subsequently. But our language bridge is predominantly engaged by the serendipity that we basically would have inherited, given the fact that we already have Hispanic practitioners within the system. Thank you.
Okay, and moving to the second question, interesting question. Now, beyond the personal benefits that would accrue from having a vaccinated individual not get ill themselves and not have the risk of severe illness and death, the other benefits that really are of relevance and importance are the benefits of overall reducing the risk of transmission through a population. So beyond just you as an individual not getting ill, lowering your own probability of getting ill and your own probability of passing on illness then lowers, once you and enough people are vaccinated, it lowers the risk through the population of the virus being transmitted from person to person. Now, the messenger RNA technology of which you've spoken is a good opportunity to remind the public that this isn't brand new technology. It is relatively new, but it's been in the works for some time. And yes, it has been used for other types of vaccinations. But it's important to note that each individual type of vaccination really only protects you from the target virus infection. So if it's the COVID-19 vaccination, that's only going to protect you from the COVID-19 virus, not other illnesses. So I don't want the concept of other mRNA vaccines for other things being confused with the COVID-19 mRNA vaccine, which is a specific thing. So each vaccine is very specific in what it happens to protect the individual from, and the benefits of overall vaccination beyond the individual extend to reducing risk of transmission of virus in the population. So hopefully that helps to clarify.
Thank you for your question, and of course, Dr. Hines, for that response. We now move to AZP, azpnews.com. We're ready for your questions.
Good morning, Private Harry, azpnews.com. My first question for Dr. Hines. Dr. Hines, there's a discussion in the States right now about whether persons who are fully vaccinated should be given a booster shot. What is the thinking here in Trinidad and Tobago? Would fully vaccinated people have to get a third and a booster shot? One. And my second question, we have about just over 300,000 of the Pfizer vaccines in the country, and of course we have about 100,000 of children who are between the ages of 12 to 18. What happens to the excess? Has a decision been made on what will happen to the rest of the vaccine? Would it target a specific group? With that, thank you very much.
Okay, thanks for the questions. Let's go backwards. So the current policy with respect to the usage of the Pfizer vaccine is that it's being used to target the pediatric population, that 12 to 18 population, and as just announced, there will also be consideration for utilization in the pregnant population, and more detail on that will be released by the appropriate directorate. At this point, there isn't any additional change in consideration with respect to who else will be able to utilize said vaccine. If any changes come up, then those will, of course, be brought to the attention of the public via these means and via various press releases. So right now, between the pediatric population and the pregnant population, that's the extent to which the utilization of that Pfizer stock has been allocated. Now, with respect to the booster dose, I know this question has been asked on several occasions, and each time the answer hasn't changed. At this point, we're not looking at booster dosing just yet, for the simple reason that even at the global level, the global WHO thinking is that we need to concentrate on ensuring that as many people get a first and second dose out of the available stock of vaccines before we start moving to whether or not a booster dose is of benefit. You're balancing two things. You're balancing the individual benefit to the people who already had two vaccines of getting a third one against the benefit of using those same vaccines to reach more of the population. And globally at the WHO level, and similarly here, the thinking is that we want to concentrate first on ensuring that as many people as possible get their first two doses, and then conversations on boosters may arise again in the future.
Thank you, Dr. Hines. We now move to IETV. IETV, we are ready for your questions.
Here's some IETV news. I have two quick questions. My first question, Dr. Hines, can you give us an update on pediatric COVID-19 cases? I know the last time over the weekend we would have been informed that 3 children were hospitalized with the virus. And my second question will go to Mr. Thomas. Mr. Thomas, is there any support system in place for children in particular who have emotional and mental issues as COVID-19 lockdown measures as a result of not going to school? Do you all have any services to treat such children? Thank you.
Okay, very quickly, with respect to your first question, I believe the CMO at his last appearance would have indicated that out of the 3 children who had initially been mentioned, at least 2 of them had been released or discharged. I do not currently have any additional information or updates beyond that at this point in time.
Yes.
In addition, specific to the question of the support systems, the psychiatric and psychosocial support system with regard to pediatric patients, they fall within the safety net that we've built that includes not just pediatric patients, but also the staff engaging the resilience building in our inherent staff. As you may recall, we are also providing training and training for our staff in meeting some of those psychosocial needs to maintain the resilience in the system. But directly engaging our patients, a team of psychiatrists and psychologists and social workers headed by Professor Hutchinson. And they have targeted, as I said, staff, patients, and now included in that subset of patients are the pediatric patients. So that psychosocial and psychological support continues.
Thank you very much. We now go to I-95.5 for your questions.
Yes, good morning to everyone. Whitfield Turner, I-95.5. Doctors Allen and Hines, I've had a number of persons asking me these questions in various forms, so I'll try and put it together as best as I could. As it pertains, first question to persons who have been vaccinated. Normally, when they have positive experiences, there is a rush, as it were, to basically cite those positive experiences as confirmation that the vaccines are working. However, on the flip side, when they have a negative experience, we hear things like, well, we have to do some more digging to find out whether it is in fact the vaccine or whether it's something else. Why is there that delay in linking the vaccine to a negative experience, but you have a quick association being made with the vaccine when there's a positive experience? And my second question, how possible is it for someone to die from something other than COVID, but still have their death being classified as a COVID death simply because their swab came back positive? So for example, they may have had a disease for a number of years, they've had flare-ups off and on, and then they end up dying, and their death is classified as COVID. How possible is it that they may have died from the disease as opposed to COVID? Thanks.
Okay, thank you for the 2 questions. I'll again go backward. That scenario that you've described is quite possible, and it is really because when we count the COVID fatalities, we aren't only counting necessarily individuals who may have died as a result of COVID complications, but we're counting individuals with COVID-19 who have died. It may not necessarily be the cause of death, although in most cases the deaths that reach us as COVID-19 deaths are those that have come out of the health system where individuals are being treated for COVID-19. Now, this may vary or differ from what is cited on the certificate as cause of death, but it's not a cause of death reporting that we're doing. We're reporting deaths among COVID-19 positive patients. So I'm hoping that helps to clarify what's actually being reported upon. Now, your first question is interesting. It's an interesting framing of the idea, and I'm going to try to see if I can unpack that a little. The first issue is that if the vaccine is seen to work, if the vaccine is seen to prevent illness, as has been shown in the just about 4 billion plus cases of vaccination that have been administered worldwide, we are basically going with the existing body of evidence and stating that what our findings are locally are in line with what has been seen in larger trials in controlled settings across the globe. We have also noted that there is a tendency or a desire to take any occurrence that happens after a vaccine as being related to the vaccine, whether or not this is so. And because of this, there is very careful examination of the origin, the cause of side effects or outcomes that aren't necessarily related to the vaccine. There's no biological or plausible reason why this effect or this event would be related to the vaccine, but you investigate to see whether there is the possibility that it may in fact be related. So what we're doing when we do the investigation is we're not delaying the association, but we're actually attempting to verify whether indeed and in fact an event is related to the vaccine. So the delay is really for verification. The delay isn't to delay association. If something is related to a vaccine, then that information is put forward. But we do have to bear in mind that individuals will have events for a number of reasons that correspond to whatever pre-existing conditions they have. And these events aren't automatically or necessarily related to the fact that they had a vaccine in the recent past. So there is a need for proper investigation to verify the link between a vaccine and any subsequent event. But it's not an attempt at preventing or delaying an association. So I hope that makes that clear.
Thank you for that clarification, Dr. Hines. We now go to 103.1 FM for your two questions.
Good morning, everyone. Sarah Chandu from 103 FM. I'm hoping Dr. Hines will be able to answer these two questions. First of all, there are people out there who would, of course, parents especially, be willing to take on the odds for themselves with regard to COVID-19 vaccines, but they will be extra vigilant and very cautious as it pertains to their children. So with that being said, is there a reporting system in place for parents to access if they believe their child is having severe side effects? Because obviously no parent wants that their child is in a particular situation and they don't have a course of action to follow. And secondly, measures being put in place, is there a way that the officials are going to track possible breakthrough infections in vaccinated children? Thank you.
Okay, so thank you for those two questions. First of all, it's important to note that if there's any event, whether it's vaccine-related or not, in a child, that the parent is, of course, immediately advised to seek medical care. If it's an urgent event, then you can seek medical care through the emergency room systems, or you can seek medical care at your customary pediatric care provider. And at either location, you can then report whether there was vaccination in the recent past or not, and that information can then be reported back to the expanded program on immunization, where these events supposedly attributable to vaccination are collated. So wherever you go within the system, you can make sure that you flag that you were vaccinated and now this particular event is happening, and that information will be taken back to the relevant collection system, because it is something that is being monitored quite actively. Now, the second bit of the question, can you repeat the second bit of the question? And I just need to clarify exactly what's being asked there.
Yes. So the second bit of the question, tracking possible breakthrough infections in children.
Okay, so again, the difficulty with tracking breakthrough infections is that you can get breakthrough infections reported when they come to the attention of the health system, but there'll be many instances in which an individual may have a very mild or not noticeable infection because the vaccine is working and is preventing them from having serious illness. So even if we were to track those that came to the attention of the system, it may not be a proper representation of all the possible the possible events of breakthrough that could happen if you were monitoring a trial of a vaccine. When they're monitoring a trial of a vaccine, then what they actually do is they either go back and check every single individual whom they've vaccinated and see whether they've had symptoms, or see whether they actually test positive for the virus, and that's how they usually do that formal breakthrough testing to look for breakthrough rates. That's not something we will be doing within our health system, but we will of course take note of any events that occur as COVID-19 infections in somebody who represents their vaccination status as complete. If they come in, they say they're having symptoms, they're tested for COVID, and they present their vaccination card saying, I've been vaccinated, yes, that will be noted. So I hope that clarifies what we can and can't do and what we will and will not be able to accomplish and sustain with regard to tracking breakthrough infections.
Thank you very much, Dr. Hines. Our final questions go to TV6.
Good morning, everyone. Urvashi from TV6. Dr. Allen, glad to see you here. I have a disclaimer, though. I'm a parent of a 13-year-old and also a 10-year-old. So I've been talking to a lot of parents of children within that eligible age group. So we have this Pfizer vaccine carrying the mRNA technology. It's not offered to us, the adult population, but we're being asked to administer it to our children. Now, I think just talking to parents, the ministry has done pretty well in dealing with the immediate adverse possible effects, the myocarditis. I think people understand it's is it 1 or 2 million? You can clarify. But parents have been asking about the long-term effects. We understand that mRNA has been studied, but it's now being used for the first time in a commercially approved vaccine. What will happen to our children? This is the question. What will happen to our children, or what stands to happen in 10, 20, 30 years from now? And secondly, to Dr. Hines, if you would be so kind as to let us know what will it take for the ministry to independently approve this tried and tested platform, which is the deactivated virus, a vaccine like Sinopharm, to be administered in children from as young as 3. We're seeing it being done in China and the United Arab Emirates. And we do have a ready supply of Sinopharm vaccines. Thank you.
Okay, thank you. I think I'd like to take the second bit of the question first. And what it would take is what it has taken with all of the other approvals. There is a process that we engage in, which is we allow the wider review of the data by the WHO technical and scientific experts, that technical advisory group that looks at reviews of all these studies that you've been referring to in China and elsewhere, and comes to a consensus on whether a recommendation can then be made to utilize the findings of these studies. Is there global overall consensus that this particular new approach is safe, this particular new approach is effective? That's what those NTAG groups do. That's what the global evidence-based decision-making process has generated as its stepwise move towards approving a new intervention, and that is the process that the ministry has been using and will continue to use to make new decisions on additional therapies both therapies and preventive mechanisms in a rapidly changing scientific environment. So the answer doesn't change once there is additional information that reaches the level of scientific consensus at a WHO level that says, yes, this has proven itself to be safe and effective, then we'll very happily move to additional interventions. Now, just taking a bit of the first question before I hand over to Dr. Alain, I just want to emphasize that a statement you made is interesting, but not necessarily, it's not necessarily applicable. You're saying the parents are claiming that we want to utilize this mRNA technology in children, but you're not using it on the adults. It's not that it can't be used on the adults. This has been used on adults in other countries, but because it's the only one that's actually available for children, we are using what stock we have to target that vulnerable group of kids who can't take any other vaccine. So it's not like we're trying something on the kids and it's not even being used in adults. It's used globally in adults. We are targeting the one shot, the one vaccine that we can give kids to the pediatric population at this point in time. I'll allow Dr. Alain to answer the remainder of the question.
Thank you for that question. And I am very pleased to hear that you are considering taking your children for vaccination. And I too will be taking my son at the end of this press conference for his vaccine. Trying now to predict what will happen 30 years down the road will be a little bit difficult. But what I can say, as Dr. Hines said earlier, this technology is not new. It has been studied quite extensively for a number of years. There have been animal models and all the scientific in-lab investigations done, and they have found no long-term effects. Yes, it is the first time that this particular technology is being ruled out to the human population, but we basically trust the science at this point that it's safe. So far, we have had, how many billion you said?
It's
4 billion worldwide, and we have not seen any deleterious effects that will cause us pause in using or recommending the Pfizer vaccine right now for our pediatric population. Thank you.
And thank you, Dr. Hines and Dr. Allen. As we wrap up today, I would like to thank our panelists for providing us with their updates, the media for their questions, and you, our listening and viewing public, for sharing your time with us today. Please remember to follow the COVID-19 health guidelines and protocols. They are available on the Ministry of Health's website at www.health.gov.tt and on social media pages. I also urge everyone to protect themselves and others against the COVID-19. Play your part by following the current public health guidelines and regulations. Protect yourself, your family, friends, and Trinidad and Tobago by vaccinating. Let's vaccinate TNT.
This is TTT. Live for local.
I solemnly pledge to dedicate my life to the service of my God and my country. I will honor my